and goods. Customize the treatment of an individual patient. It is not same in all situations. Examples, if a patient of hemiplegia comes to us, stroke patient, so it can be just hemiparesis or it can be in the form of hemiplegia. So in both the conditions, the treatment will vary. Hemiparesis patient can be given treatment or can be taught exercises for the home management, while a patient with complete paralysis or hemiplegia should be attended by a qualified physiotherapist only, because then the results will not be the same. So we are responsible for about the result or the outcome of the patient. Non-maleficence is the principle we should not harm the patient in any way. Every medical action must be weighed against all the benefits, risks, and the consequences. It applies to the individual level of training of the professional. We should always practice evidence-based practice should be done, not like for back pain or neck pain, we should start using cupping or needling, and while the patient needs ergonomic advice, the patient needs posture correction and some strengthening exercises. So idea is that evidence-based practice should always be used, whether it is the hospital or your own clinic. Moral rule of non-maleficence include not to cause any suffering or any harm to the patient. Justice is very important. Another aspect. Justice of distribution comes in the medical field. Everyone should get access to therapeutic advices, no restrictions about the finances. For giving justice for health, Ayushman Bharat for universal access by our Prime Minister. Health justice gives humanity dignity. This is a fundamental right that we all should get facilities for our health. It gives person or it gives person what he deserves, is irrespective of gender, age, caste, religion, or nationality. All are equal for the fair treatment of the problem. Behavior. We all professionals should interact with the patients and the staff. Right of medical to the professionals, to the patients, all have need justification for their behavior in the hospital. So general public, we have to see general public, their patient and their families, and it applies to the medical professionals like us. As far as justice is concerned, when we give the appliances to the patient, suppose a poor patient comes to the hospital and needs a ventilator, so we should not think of his position. Say giving a belt to the patient or issuing it from the government quota. So all patients are same if devices are to be issued to the patient in spite of the cost of the device. A ventilator is a costly thing, while a lumbar belt is a not very costly item. All should get it. So transparency and honesty is another important factor while giving the treatment to the patient. This should be shown. The consultation fees, the intervention should be explained to the patient what we are going to do with the patient, and if we are not qualified for a particular kind of a treatment, we should not do that treatment. So the qualification is very important whenever we do any treatment to the patient. Say a patient comes with backache, with a disc problem. So his question is usually, can this disc problem can be reversed? They usually come with MRI. So in some cases with physiotherapy and apart, like, the exercises, the proper positioning, some treatment, the bulging disc can be corrected to some level and can be seen after a few months in MRI. But a sequestering or a ruptured disc, we cannot reverse it. So we have to be very transparent and honest with the patient while giving them treatment. We should be very friendly with the patient. The clinic, the hospital should be patient friendly. We should schedule the appointment so that we can avoid long waiting. Time is money today. So, and then we should see that when patient is talking about his problem, he should not be interrupted in between or should be distracted. We should allow the patient's relatives and friends, if they want, in the examination room so that the patients are comfortable. When patient comes to us, we should explain about their prognosis, their diagnosis, and about the treatment, what we are going to give them in simple words, the language which they can understand. We should also at the same time discuss about the other options available. We should take written consent before starting the treatment. When the patient is satisfied and convinced, only then we should start the treatment. We should not manipulate any treatment or anything forcibly or give something, the false promises for the treatment. We should implement the patient's charter. Patient charter includes patient's rights and responsibilities. Publish the patient charter in different languages, Hindi, English, and local languages. Display the charter at multiple places so that they know about it. Implement patient's charter every day. Then there are few rights of the patient. Right to be treated by respect. They can get medical records. Privacy of the patient of medical records should be maintained, should not be shared by others. Patient can make treatment choices. When we give them 2 or 3 choices, they have the right to take the opinion. They can choose the treatment. We should take informed consent, and they are at the same time, once we advise them and give them, they can refuse the treatment also. So the last and the most important part for terminating patients, the patients who are in bad shape or they are after roadside accident, or they are 85 or 90 years of old, then in such cases, the patient's relatives, they can take decision about the end of life's care. That means we are not supposed to put them forcibly on the ventilator or keep them in the hospital, or for physiotherapy, a patient comes with multiple, say, peripheral neuropathy case. Though he needs physiotherapy even after 3 years of recovery, but we should not promise them that there is further recovery, because if patient is on treatment right from first day, he will be continuously improving for a number of years, but after a time, it will be only for the maintenance. At the same time, when patients' rights are there, they are equally responsible for few things. When we take the history from the patient, they should sincerely share everything so that we can plan and assess the patient. So patient's information from their mouth is very important. Patients should respect the doctors and the staff of the hospital. Utilization of the system of the hospital should be done properly. It should not be wasted. Patients should be responsible for their health. They should follow all the instructions or the medicines, whatever is being advised to them, to get the best result. They should also take care, as nowadays, we should try to use mask so that we can stop the spread of the disease or minimize the spread of the disease. We should wash our hands, or the patient should wash their hands number of times. At the same time, when they are getting the facilities from the hospital, they should pay the money or the fees which they are committed to. Following the rules of the hospitals, rules and regulations, they are equally important for the patients and their relatives also. Once we finish the treatment or once we are giving the treatment, patients should accept the results because we have explained everything to them, and they should not insult the health provider if the results are not according to their expectation. So there are conflicts between the main principles, and these principles are only for the references. Every reference is, or every situation is not mentioned in the code. So codes are used, and when we are in ethical dilemma, they are used for the references, but answer of every problem is not in the code of conduct. And for that, we can take advice from the other members of the team. When we are talking about the professionals' duty, this fiduciary responsibility to the patient and hospital are often contradictory. Like a patient comes with a neck pain, we want to have some money, or we want to make some money for the hospital finances, or try to cover the finances from the patient, but they are not actually required. A patient with neck pain may be corrected at home only without any MRI or X-ray or investigations, with exercises, ergonomics, and postural correction. So that also we have to take care. So always code of ethics, they cannot be applied. Thank you for patience listening, and thank you my team for helping me in this presentation. Thank you.
Thank you, ma'am.
Any questions?
If anyone has any questions, please put them in the chat box.
Chat box.
Ma'am, please guide them how to dress up once they go into the hospital system.
Yeah, it is very important, because when we go to the hospital, we know we have, all professionals, they have some code. Like nursing, they have a nursing dress. The physiotherapists, they have a apron. The lab technicians, they have some kind of apron. So very important, we should not wear short dresses, we should not wear funky dresses, and the dress should be according to our culture. That's the most important part. So once we go to the hospital, this should be taken care, and it should be nicely washed, neat, and ironed, and properly fitted. Properly fitted means so that you can work in a comfortable way. That's the most important part.
Any questions from the audience? Ma'am, we have a question.
Can you hear me?
Yes, ma'am.
Saroj ma'am, thank you so much.
Hello, Nidhi. How are you?
I'm good, ma'am. How are you?
All well. Thank you for giving this opportunity.
Arey nahi, ma'am. You have given us the opportunities. I mean, you trained us, so we are here.
And it's since long 7 years after retirement. So really good to be like this or doing something for the profession.
Of course, ma'am. And I mean, I'm feeling really blessed to have you and listening and learning from you after such a long time. I mean, I remember it must be around 16, 17 years.
Yes, Nidhi.
So it feels great to have you here and listen to your experiences and the presentation. Thank you so much, ma'am. And I would just like if you could tell our students then how they should behave in a hospital setup. What are the expectations from them in
Yeah,
terms of their behavior?
yeah. One thing I would like to say, once punctuality is the most important part. First is punctuality. Then second should be the dressing sense. Third, listen to the patient. Fourth, don't try to make relations. Patients are patients. So just listen them carefully and then advise them. And don't use your mobile, take the history, do the prognosis. If you don't know something, take the help of your seniors. That's very important. As far as taking history and telling about the X-rays or MRI, if you're competent, only do that. If you're not competent, please take and consult with your seniors and tell the patient that madam will be guiding you.
Yes, I think all these points are really important for, how we behave with somebody, how we have our relationships in the hospital setup with our colleagues, with our juniors or seniors. It is very, very important how we are dealing with them and the way they are dealing with us. I think, besides patient and therapist relationship, it is also important to have cordial relationship with our, fellow colleagues.
Yes, very important. Peers and
Very
the
important.
staff, juniors and seniors.
Yes, yes. Because
Agree
mutual
totally.
respect and trust is required at most.
And this is the college only when we are going to or they can learn. Later on, no one is going to teach them.
Yes.
Ma'am, we have 2 questions in the chat box. Kindly explain the ethical dilemma.
Like one has to be very specific. The ethical dilemma is the patient comes, say, for neck pain only. And on one side, patient wants that he should be given treatment which can help the patient without spending much money. But suppose we are working in a multinational hospital. At the same time, we have a pressure to meet the financial demands or the requirement of the hospital. So unnecessarily, we put the patient for, investigations. While X-ray or MRI for a postural problem or a mechanical pain in the neck is not required, but still we do it. One thing. Second, take the example of a patient, 85 years of age, who got a stroke. But he doesn't need, really, if all the organs, they are not working or he's going into multiple organ failure, still we put the patient on ventilator. So that is not required actually, but we do that. So this decision is to be taken by the family members. We should explain them and accordingly we should act.
Thank you, ma'am. Ma'am, there's one question that sometimes we find that the patient is not so cooperative with us. So what should the students be doing at that time?
See, they should not take the decision, listen to the patient properly and keep quiet. Say yes, sir, or yes, madam, whatever, and report the problem to the senior because everything at junior level cannot be managed. So it is to be told to the seniors and they will come into the action or they will manage the show.
Yes, ma'am. Ma'am, one more question we have. Any guidance about how to overcome fear and get confidence being a new joinee?
Yeah, every day, take the history of the patient. Please read, go home, whatever the questions, where are the doubts. So first day, just listen to the patient and do minimum whatever you know. And after that, take advantage of net take advantage of your seniors, and then next day you can manage the things. So it is the confidence which you get. It comes with time and repetitive reading, learning. You get better.
Ma'am, there's one more question from one of our students. Ma'am, please tell us some important tips during the interview.
See, interview, whatever you know, answer that. Please don't answer irrelevant answers, because it gives a lot of irritation to the examiner or the person who is hiring you, or you are going for any interview. So whatever you know, just answer that. Don't beat around the bush. That gives bad impression.
I mean, answer to the point, basically.
Yes, if you know it,
Anything
yes, we know it.
an answer.
If you don't know, don't just answer anything.
This is a basic tip that we also give while the students are appearing for their practical examinations. Please answer to the point, answer what is asked.
Right, exactly.
Any more questions from the audience? Ma'am, there's one question from our student. How to deal when a patient keeps on asking questions after questions, when the patient is getting impatient?
Yeah, this is very common. Most of
Yes,
the,
ma'am.
not all, but at least you'll find every day 10% of such patients. So keep listening, and in the end, ask few questions and say, these answers I will not be able to answer. You can discuss this with my senior when you have the appointment with them. My knowledge or my level of answering is only this much. Because so many questions even I don't know. They keep asking the orthopedic problems or the surgery problems or the cardiac problems with me. I say, this is not my field. I know only this much. I can answer this much. Just stick to your profession, to your syllabus, and that will help. We know our limitations. We know how much we can, what is our field. So we have to stick to only our profession and not to answer everything.
Ma'am, there's one more questions. Ma'am, how to deal with patients who don't trust us being new to the hospital? They keep on calling their previous therapist.
See, this happens in the private clinic also. So why they have left the previous therapist? First, you should ask them. Because their nature is like that, and they keep trying, most of the people, 2 therapists, 3 therapists, they want the result. If you know your subject, if first day itself, if you can tell how much time, like the sciatica, the brachyalgia, they are going to take 4 weeks, 6 weeks, or maybe just 1 month, 1 week. So when you explain about the problem to the patient first day itself, and then you can take the history properly, why they have come to you or why they have shifted to you. So you will come to know whether the patient is like this and just going from one therapist to the other. So the answer will be very clear, and there won't be any problem. Because if and then properly you can tell them, if they believe you, if they have trust in you, they should continue. If they don't have trust in you, then you just can't do what they want. Because you will be doing evidence-based practice. You cannot just do things which they want. It is your responsibility for the results.
I think besides technical skills, ma'am, I would like to add here that besides being good at your skills, your knowledge, one must be also good at non-technical skills, soft skills, because it is important what you are doing, what you want to do, or what is your line of management should also be conveyed to the patient convincingly.
Right, I agree.
Yes. So
Softly
soft
manage.
skills besides technical skills are equally important, and usually such skills are undermined because of which these problems occur.
I know. Nidhi, I agree. Because politeness is very important part on your profession, because patient is already in the pain and they are frustrated. So that is why they are changing the therapist. So we have to convince them, that is politely with your knowledge. Convincing is very important in the right direction.
Ma'am, I also have a question.
Yes, Amanshu.
Therapist is male and the patient is female. What precautions should we be taking?
The patient is,
Ma'am, he's asking if the therapist is male and he's treating a female patient, what all precautions should he be keeping in his mind?
see, I was working in a government organization, and now I'm working in a private setup for last 7-8 years. It's important that we should have a female attendee or a partner or a patient or a relative at that time.
Or even a nurse?
Anybody in the, it's very important.
Or whenever you are, touching that patient, always take a consent first.
Yes.
Like explain that how you're going to touch the patient, how you're going to palpate, or what protocol do you wish to perform on that patient. Having the prior knowledge of the treatment will definitely help the female patient to trust you a little more.
That's right. Because when I get a patient in the hospital, or even today, even when I get a male patient of 24 years of age, and suppose I have to see the low back of a male patient, there first I explain what I'm going to do, how I am going to assess the patient, how much exposure of the body I need. So if you explain and patient says, go ahead, please, only then I do it. I am of this age, but I will not touch any male patient without explaining. Even I will not touch a young female lady also. So before examination, before assessing, explanation is required. And once patient says yes, please go ahead.
Yes, ma'am. Ma'am, there's one more question by our student. How to deal with a fussy patient?
See, again, as Dr. Nidhi has said very clearly, you have to be polite, soft, listen to her or him, and then go gradually, slowly, because these things you have to learn with passage of time. You have to have patience for that. You cannot be rough in the hospital or the clinic.
Ma'am, there's one more question by Aman Kanda. Ma'am, I have seen in a clinical setup that the physio is talking aggressively with the patient. When I asked why you talked in such a manner, she said because the patient is psychotic. Ma'am, how to deal with a psychotic patient?
See, if the patient is psychotic and you know about it, then it is rather the more, it is the requirement of the situation, you have to be softer because you know the problem. So that means it is a problem with you, not with the patient. So you need what you call guidance or counseling rather than the patient.
Yes.
Because patient is in pain, patient is in problem. He or she has come to you.
I think empathy is the right word. I mean, one should be
Yes.
empathetic towards that patient's.
All patients. I will
Yes.
say all patients rather.
Yes. Yes. True.
Because patients means they have some problem, and to solve that problem, they have come to you.
Any more questions from the audience? Students, you can come up with your questions.
I think ma'am has answered all the queries nicely and patiently.
I think so. If I'm of any help to the students, I will like it.
Of course, ma'am.
Definitely, you've been a great help for us.
Any questions?
I think, ma'am, there are no more questions. Either they
So-
know all these things, or I think once they'll experience, then they would realize the importance of whatever you have
Ma'am?
conveyed through this presentation.
Nidhi, it takes number of years to
मैम
learn.
आई हैव वन क्वेश्चन
Yeah.
मैम अगर पेशेंट थेरेपिस्ट से या पेशेंट हमसे बहुत ज्यादा इम्पोलाइट हो रहा है आर्ग्यू कर रहा है और मैम हाउ हाउ टू डील विद दैट पेशेंट
See, you are not supposed to answer the patient because argument becomes hotter when you start answering because he is not in mood of listening, right? When he is not in mood of listening, you cannot do anything. So just listen and let him speak and go. You can't force him to stop. So that moment, better to keep quiet and then report it to your seniors and things will be settled.
Ma'am, there's a very good question in the chat box. Ma'am, if I'm working in a big private setup and my bond with patient becomes good, and he or she wants me to treat herself in private and want to call or contact me in person, what should be the borderline? I mean, what I'm guessing here is if they approach them for a private visit, what should they be doing in that scenario?
See, when you have understood that the patient is crossing the limit and you are not comfortable, please say politely, I don't have time, I am not competent, I don't do the home visits. Find out a good excuse rather than saying no directly or telling that you are uncomfortable. Or send your other colleague, give the reference because of some personal issues, I'm not able to come. And I will give the reference of my other colleagues. If he or she is interested, will say yes, otherwise it should be stopped. This happens in my private clinic. Patients, they come and they want a particular physiotherapist. And the physiotherapist becomes uncomfortable. I don't think of my finance resources or finance advantage. I just say, you stop seeing this patient, somebody else will attend. Or I say politely to the patient, you don't need further treatment in my clinic. So we'll teach you home management.
मैम अगर पेशेंट गूगल से पूरा वो पढ़ के आया हुआ है और उसके बाद बता रहा है कि मुझे ये प्रॉब्लम होगी तो उस पेशेंट से कैसे डील करेंगे?
नहीं, देखो अभी इंटरनेट के आने से एक पेशेंट एक डायग्नोसिस, वो डायग्नोसिस के साथ ही आता है और डायग्नोसिस के बाद वो ट्रीटमेंट भी आपको बताता है, राइट? So it is your duty, if you are qualified, you have done the complete BSc or BPT, whatever. So still you say, before I start the treatment, I am responsible for the results. So if you want, we can go ahead first with the assessment and then with the treatment and explain. Because results, you are responsible for the results, not the patient. So they have a lot of knowledge. So they come with fixed mind. ऐसा होगा, ऐसा जाएंगे और ये आउटकम होगा. That is why I'm saying sometimes they expect कि ब्रेकल्जिया शाइटिका 5 दिन में ठीक हो जाएगा, पर नहीं होता. आपने जो पढ़ा देखा और उसकी क्या पोजीशन है नर्व की, हमें नहीं पता कितना कंप्रेशन है, how much time it is going to take. So there are different stages of the disease. So you have to explain politely. It can happen from this much time to that much time.
Thank you so much, ma'am, for guiding us on this very important topic, conduct in hospital setup. I think all of us are learning a lot from you.
Thank you, the team, Dr. Nidhi, Dr. Neha, and Dr. Kavita.
Thank you so much, ma'am. It was good to see you and hear you after such a long time.
Same here, Nidhi. Same here.
It was a great
I
pleasure
hope
to
we'll
have
be
you
back in
here
touch
today.
in future also.
Yes, ma'am, of course. Yes, yes. I would love to.
I'll have your number. I
Thank
think it's not in the records. Tell that. Thank you, Nidhi, once again.
Thank you so much,
Thank
ma'am,
you
for
so much,
giving us
ma'am.
time.
Thank you, Neha.